A very warm welcome to all of you for this ECFR Quarantimes call. As you know, the calls are designed to bring out some of the most interesting voices around the world to help us think beyond the immediate response to COVID-19 and overcome some of our pre-existing biases and beliefs to help shape a view about how the world is changing and what Europe's role is going to be within it. And really excited about today's speaker. Frank Snowden is the Professor Emeritus of History and the History of Medicine at Yale University. And his book, Epidemics and Society, From the Black Death to the Present, examines the ways in which disease outbreaks have shaped politics, economics, and modern societies. And what I think is particularly fascinating about it is that he sees epidemics like the coronavirus as a sort of mirror of humanity, reflecting back to us many of the intrinsic features of our world. And his book goes through many of the ways that our society has been shaped by previous epidemics and pandemics. So we're absolutely thrilled to invite you here today, Professor Snowden, to share with us your views and to help put the psychodrama that we're all living through today into this bigger historical context.
I guess what I would begin by saying is that I would regard epidemics, as you were just saying, as real mirrors, that a looking glass that reveal the nature of the society that we live in. And I think I would make a contrast between two different periods. One, to illustrate what I mean, I would regard Asiatic cholera in the 19th century as the great disease of industrializing society, with urban centers that were teeming, terrible sanitary structures, lack of supply of safe drinking water, a lack of sanitary regulations, lack of sewer systems, the ideal sort of environment for the transmission of a disease that is spread through filth and through the oral fecal route, as it said. Instead, that we're no longer vulnerable in the industrial world to a disease of that kind because the sanitary movement was instituted in the second half of the 19th century, beginning in Britain and then spreading across Europe and North America. And therefore, there's no chance for a disease like typhoid or Asiatic cholera spread in that way to thrive in our midst. On the other hand, I would regard COVID-19 as the first great pandemic of globalization. And by that, I mean a number of the main features of globalization are actually the direct channels. In other words, epidemics are not random aspects. They don't strike societies by chance and at random. They follow channels that we ourselves have created that they are able to exploit. And in this case, I believe the leading features I would point to, we can talk about them if one wishes, the great population demographic explosion, where we're nearly 8 billion people in the world, and one day, who knows, there may be just standing room only left on the planet. I would also say another feature is a rapacious industrialization in which there is the view, the sort of Chicago school, Milton Friedman view, that the economy could grow ad infinitum, infinitely, despite the fact that the planet has limited resources. And with that went failure to take into effect in calculating profit margins, the actual external costs that industry was creating. And so this led to a rapacious attitude towards the environment. And I'm thinking in particular of the way in which palm oil companies, mining companies, and various other companies have really led the way in deforestation. And that is something that we see leading that many more contacts between human beings and various animals that humans rarely, if ever, encountered in the past. And for human beings, the leading problem has been with bats who constitute a vast reservoir of viral diseases, pathogens that are particularly lethal to human beings, of which the one that we're suffering now is one. And we've seen a whole succession of those, from avian flu through Ebola and MERS and SARS, and now coronavirus. So what is happening is that we are increasingly frequently being challenged by diseases of that kind, by those viral diseases, and we notice that other features of globalization are directly important. One, teeming urban centers. And at Wuhan, the disease spread possibly from a market, as we all know, to the family of shoppers, and then to other people in a densely crowded urban area. And then we have a world in which millions of people, at least until the end of last year, were constantly on the move through commerce, trade, cultural exchanges, tourism, and all linked in such a way by air travel, the transport revolution, that what happened, let us say arbitrarily, at Jakarta in the morning would happen in Los Angeles and Paris by the evening. So this is a disease then that is, I would argue, the first great disease of globalization. And I think that it reflects the nature of that society and various features that are vulnerabilities of it. Our transportation system, not only between countries, but also within cities. The metro systems and buses have been drivers of this disease. A fragmented world order in which international institutions like the WHO, the World Trade Organization, are weak and have few powers and are chronically underfunded. This applies also to the European Union, which wasn't prepared for this catastrophe and also has not played a leading role. Rather, it's been fragmented by individual countries taking their own separate positions. I think we have an intellectual crisis about our economic model. We have also the fact that poverty has been a major driver of this. Poverty on a global level between the world north and the world south, and also poverty within individual countries. Massing and growing inequality as well. And so we see, if you look at New York City, for example, that it is ethnic minorities who have suffered most, or people incarcerated, people who don't have access to health care, who don't have insurance, who can't afford not to go to work, whose work environment is also crowded, and the housing conditions are crowded. Those are enormous drivers of this. And what's happening at the moment, most tragically, is the North-South divide. This is a disease that is exploiting the poverty of third world countries and the fact that there's no way to practice the social distancing, which is the only measure that we have to protect us against this disease, is impossible to practice in a favela in Rio de Janeiro, or in a shawl in Mumbai, or in a township in South Africa. And so it looks as though the UN even suggested that this may trigger famine, and there are now about 250 million by UN calculations, people who are actually at risk of starvation. So we're really seeing a major tragedy, and one that was preventable and need not have been, at least preventable in the sense that it need not have been the catastrophe that we're facing, because there's a long history of calling for preparedness. And this is, in fact, a tragedy that has been long foreseen. Beginning in 1997 with avian flu, there's been a sense among virologists and epidemiologists that we would inevitably be challenged by pulmonary viral diseases. And in 2005, Anthony Fauci, whom everyone knows, and Julie Gerberding, who was the Director General of the American CDC, testified before Congress. And what they said was chilling now in retrospect. They said to Congress that if you lived in the Caribbean, meteorologists could tell you that a major hurricane was inevitable. They couldn't tell you the date, and they couldn't tell you the force of the winds, but they could tell you that if you didn't prepare, then that was a major problem, that whose consequences you would suffer. They said it's precisely the same with medical science, that can tell you inevitably that an epidemic of major proportions is inevitable, looming in the not distant future. And if we aren't prepared for it, then we will suffer terrible consequences that could be prevented. Unfortunately, the world seemed largely to have ignored that warning, which is one of the main reasons we're in the position we are today. That is to say, we've practiced, as Dr. Tedros of the World Health Organization says, practice around the world of feast and famine. When SARS broke out, there was a moment of funding, of recognizing that we must have in preparedness plans. They were drawn up, and then the funds were cut. And that's been the story ever since. Around Ebola, there was at that time, again, a flurry of spending and preparedness, and then that lapsed again. And we see that by the time this pandemic began to challenge the world, that we had retreated around the world into national bunkers, which is exactly what Dr. Tedros would warn about, because microbes don't respect national borders. And instead, we didn't have international cooperation. There was no also preparedness of health systems with surge capacities and all the rest. So I would say that we're now suffering a pandemic that has been long foreseen, that we didn't prepare for, that is something that relates to our nature, the various features as a global society, a globalization that has been unregulated. And I think that those are major drivers of this pandemic. And I think that it's entirely important that major changes be taken, not only to overcome this pandemic, but there's no reason in principle to think that this is the last, that there will be other challenges. I'm not forecasting death and doom. I'm forecasting challenges. And my great hope is that the world will be prepared when the next one comes, so that we don't relive this experience of being caught without any adequate preparation at all.